Hello students, we will continue experiment number 8, that is preparation of dispensing and auxiliary labels for solid dosage form. So firstly we will see the theory behind this, that is it is a dispensing label, it is affixed to the prescription medicine by a pharmacist. Then it contains the directions for administering medications as well as essential safety and efficacy warnings are included there. Then what are the things in on the dispensing label? So dispensing label include the following, that is first one is patient's name, medicine name, both generic name as well as brand name, number, prescription number, dosage form, whether it's a tablet, capsule, IV injection, then it stands 500 mg, 1 mg, 1000 mg, whatever it is, and frequency of administration, that how many times you have to take, that is that is frequency 5, that is 3 times in a day, like that. Then quantity of the medicine dispense, then other specific directions for use, that is before or after meals, dispensing date, refill information, name and address of the dispensing pharmacy, name of the pharmacist and prescriber. So these things are there on the dispensing label. Then after that, see next one, it's a auxiliary label. So auxiliary label, it is also the cautionary label, advisory label or warning label. See, there are three names of these auxiliary label are there, that is cautionary, advisory and warning labels. Then these auxiliary labels, that is it contains specific warnings, direction, guidelines, then directions for things to avoid or to do carefully while taking the drugs with other drugs. Means suppose that is do not drink alcohol while taking this medicine, this type of directions are there in that. Then what is the need of auxiliary label? So to ensure the correctness of the medications, to reduce medication errors, to promote the patient adherence to medication, so this is the need of auxiliary label. Then the examples of this auxiliary label for solid dosage form, so in that first is do not chew or crush, swallow whole, take with food or milk, not for rectal use, take on empty stomach, may cause drowsiness, may cause urine discoloration, protect from sunlight. These are the examples. So these are of auxiliary labels. Then now see what are the requirements here. So dummy prescription, pen, paper, notebook, manual, common label is there. Then now see this is, so here activity 1 is identify the components of given label. So here you have to identify the component. So this is the label, this label is given and based on you have to identify the component. So here first is patient's name, so patient name is mentioned here, that is the Raviraj Deshmane. Then medicine name, so medicine name, it is metoprolol tablet is there, so tab metoprolol, and brand name is Metolar 25. Then dose is of course 25 mg. Then frequency of administration, so see here given take one tablet 2 times a day, so 2 times in a day, is its frequency. So that is frequency is take one tablet 2 times a day. Then quantity of the medicine dispensed, so here quantity, see here under this is the quantity is 30, quantity is given here. Then specific direction, so a specific direction is take regularly and complete the course. Then date of dispensing is given. Then see here auxiliary label, so that is see avoid alcoholic beverages. We had seen in the auxiliary label specific directions or what to avoid while taking that particular drug, and that is what other drugs, another drugs to avoid while taking that drug is the given in the auxiliary label. त्या ऑक्झिलरी लेबलमध्ये काय दिलेलं असतं की एखादं मेडिसिन घेताना अवॉइड काय करायचं आहे आपल्याला, म्हणजे अल्कोहोल घ्यायचं नाही आहे, किंवा पर्टिक्युलर मेडिसिन आहे हे ज्यूससोबत घ्यायचं, पर्टिक्युलर मेडिसिन आहे हे मिल्कसोबत घ्यायचं आहे, हे दिलेलं असतं ऑक्झिलरी लेबलमध्ये. And may cause dizziness, हे झालं auxiliary label. Name of dispensing pharmacy, that is given. Then name of the prescriber, doctor name is given. So this is the simple one. Activity 1 is there, that is identify the components of label given below. So here that simple is there, simple parts are there that you have to write down. The next, see that is activity number 2 is there. So from the prescription and data given below, that is you have to prepare a dispensing label containing auxiliary label in this space provided. Then now see, this is the see now this is the prescription is there. So from that prescription you have to prepare the label, dispensing label आणि ऑक्झिलरी लेबल ह्या प्रिस्क्रिप्शनवरून तुम्हाला बनवायचं आहे. सो इथे सगळं दिलेलं आहे, ॲड्रेस, पेशंटचं नेम दिलेलं आहे, डेट, एज, जेंडर ऑफ द पेशंट, एव्हरीथिंग इज गिवन. नाव नेक्स्ट इम्पॉर्टंट पार्ट, आता मेटफॉर्मिन आहे. डायबेटिक शुगरसाठी हा ड्रग वापरला जातो, इन दी अँटी डायबेटिक ड्रग आहे हा. 500 mg BD विथ फूड 30 डेजसाठी. सो आता इथे ह्याच्यावरून तुम्हाला लेबल तयार करायचं. सो हा बघा, हा जो आहे हा काय आहे, हा लेबलचा आयडियल फॉर्मॅट आहे. सो ह्या फॉर्मॅटनुसार तुम्हाला हे लेबल आहे ते बनवायचं आहे. दॅट इज सी फार्मसीचं नाव आहे ते द्यायचं आहे, माऊली फार्मसी लक्ष्मी, जो काय ॲड्रेस आहे. फार्मासिस्टचं नेम लिहायचं आहे. त्याच्यानंतर इथे डेट येईल. इथे आहे, इथे बघा सानिका रसाळ हे पेशंटचं नेम आहे, डॉक्टर गणेश पाटील आहे. आता बघा नंतर आता मेटफॉर्मिन 500 mg टॅबलेट, ब्रँड आहे ग्लायकोमेट 500 mg. देन टेक 1 टॅबलेट 2 times a day with a food. Then after that next that is the take 1 tablet 2 times a day, quantity with food. आता see here BD is given, so BD means BC in a day, 2 times in a day, so 60 mg. Then now see here, store in cool and dry place and keep away from reach of children. So here this is the given here, that is store in cool and dry place, keep away from reach of children. Then metformin is taken with meals, usually to avoid GI irritation. Then it causes the lactic acidosis. So due to the metformin it causes lactic acidosis. Then schedule, it's a schedule H drug is there. So see, this is the ideal label that you have to prepare here. So you can take this screenshot of this. Then now see activity number 3 is there. So here this is the dummy prescription. So this dummy prescription is there, so that is given by me, patient name, and drug is given carvedilol 10 mg. So from this dummy prescription now label you have to prepare the label. So refer this as a dummy prescription. हे प्रिस्क्रिप्शन आहे, हे डमी प्रिस्क्रिप्शन म्हणून रेफर करा आणि त्याच्यावरून तुम्हाला काय करायचं आहे, तुम्हाला लेबल बनवायचं आहे. सो इथे तुम्हाला ॲक्टिव्हिटी 3 दिली आहे की रेफर डमी प्रिस्क्रिप्शन ऑफ एनी सॉलिड डोजेज फॉर्म अँड प्रिपेअर डिस्पेन्सिंग लेबल कंटेनिंग ऑक्झिलरी लेबल इन दी गिव्हन स्पेस. सो नाव सी दिस विल बी युअर लेबल, हे येईल तुमचं लेबल येईल. आता कार्विडायलॉल हे दिलेलं आहे. सो बाकीचे बघा, फार्मसीचं नाव, फार्मासिस्टचं नाव आहे, डॉक्टरचं नेम, पेशंटचं नेम आहे. देन कार्डिवा CR10 mg हा ब्रँड नेम झाला त्याचा. डोस ॲज डायरेक्टेड बाय कार्डिओलॉजिस्ट. देन टॅबलेट शुड बी स्वॅलोड होल अँड नॉट च्यूड. It's a age drug, schedule age drug, so warning to be sold by retail on the prescription of a cardiologist only. Then now see, that is some auxiliary label part is store at room temperature, protect from light and moisture. So these are your these 3 activities are there. Then now see, so for the activity that is watch the video, repeat, watch the video again and again, then you will come to know about all this. That is, sometimes you can pause the video, sometimes go back and watch the video again and again, then you will come to know. Then now see, next is question, define dispensing label and auxiliary label is there. So simple definitions are there. Dispensing label, it is a label affixed to the prescription medicine by a pharmacist. It contains, that is instructions for administrating medications as well as essential safety and efficacy warning. And auxiliary label, it is a cautionary label which is applied to dispense medicine to provide extra information to the patient on the safe administration, use, storage of the medicine. So this is auxiliary label. Then now see the components. What are the components of dispensing label for solid dosage form? So these are the components of dispensing label, that is patient name, medicine name, both generic name, brand name, prescription number, dosage form, strength, its frequency of administration. Then the quantity of medicines, here quality not quality, it's a quantity of medicine is there, that is 30 tablets, 60 tablets. Then other specific directions for use, if any, refill information, date of dispensing, then name and address of dispensing pharmacy, name of the pharmacist and prescriber. So these are the components of dispensing label for solid dosage form. Then now see, next is the examples of auxiliary label for solid dosage form. So see, these are the examples of auxiliary label, that is, do not chew or crush, swallow whole, take with food or milk, not for rectal use, take on an empty stomach, may cause drowsiness, may cause urine discoloration, protect from sunlight. So these are the, what are these are the specific warnings, these are the specific precautions are there in the auxiliary label. So don't confuse in between the dispensing label and auxiliary label. See, dispensing, these are the components. See, patient name, medicine name, or other means that what are the necessary parts are there, necessary things are there. These are the components of dispensing label, and these are the examples of auxiliary label for solid dosage form. Okay, so thank you so much for fully watching this video. Happy learning, stay safe.